How do you know that the weakness you have in an extremity, it could be the arm, the leg, or both, is due to a stroke, or it's due to a herniated disc or a bulging disc pushing on a nerve? We have some patients that come to us and they have weakness in one extremity. They're diagnosed that they have a massive disc pushing on a nerve and they will surgery is recommended. But when we see them, we examine them, we find out that what they have is an acute stroke and not a disc. Now they could have a disc, however, it's not causing these symptoms. Now we're going to be talking about how do I differentiate if it's a disc problem or a stroke problem as a patient or as a physician. As a patient, first we look at the onset of the symptoms. If the onset of the symptoms is abrupt, is quick, then it's most likely a stroke. Discs typically do not cause an abrupt onset of weakness. Then I look at other associated symptoms. If it's a pure weakness, it's most likely a stroke. If there is a associated numbness, tingling sensation, and especially pain, then I would think about a disc. I look at the distribution of the weakness. If it's in one extremity, it could be a disc, but if it's in half of the body, right side, left side, then it's most likely a stroke. And I look particularly at the face. If you have facial drooping, then it's most likely to be a stroke. Now also I look at the risk factors for a stroke and the age of the patient. If it's a younger patient, do not have risks for a stroke, then it could be a disc. If it is an older patient with risk factors for stroke, including high blood pressure, diabetes, high cholesterol, smoking, all of those are risk factors that makes me think it is a stroke. Now finally it goes to the physician. The physician will do their clinical examination, a clinical history, and will determine based on the onset of the symptoms, distribution of symptoms, and associated symptoms and associated exam. If the face is involved, it's most likely a stroke. If you have hyperreflexia, it goes with a stroke versus a disc disease. And at the end, the physician will order either an MRI of the spine, if it's in the neck or the lumbar spine, or an MRI of the brain to confirm the diagnosis. Based on that, will initiate treatment. The bottom line from everything that I said is that when you have weakness in an extremity, it could be one extremity, two extremities, or the face, this is an urgent or an emergency that you should go to the emergency department and you should see a neurologist, because they will determine if what you have is a disc problem or if you have a stroke, and both of them need to be treated urgently. However, they're treated differently. Thank you.